This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Lalema Aneja Dang, and with me is Vaibhav Srivastav. The headlines. Centre interministerial teams reach West Bengal, Madhya Pradesh, Rajasthan and Maharashtra to make on-the-spot assessment of COVID-19 outbreak. Finance Minister Nirmala Sitharaman appreciates New Development Bank's emergency assistance of $1 billion to India to combat COVID-19 pandemic. 15th Finance Commission to assess implications of the COVID-19 pandemic on GDP growth. 301 Lifeline Udan flights transport 507 tons of medical supplies across the country during the lockdown period. Anganwadi workers and assistants of Madhya Pradesh to get benefit of Chief Minister COVID-19 Yodha Kalyan Yojana, and in a highly volatile situation, US crude oil futures hover around $0 per barrel for the first time. Home Ministry officials said that the ministry is regularly monitoring enforcement of lockdown measures. Briefing media yesterday, the officials said where violations of lockdown are occurring, suitable measures are taken in discussion with states. She added that the Home Ministry has also written a letter to the states stating that guidelines made under Disaster Management Act are to be followed strictly. States and union territories have been advised that they cannot dilute the Home Ministry guidelines issued under the Disaster Management Act 2005.
In West Bengal, 2 interministerial central teams have arrived in the state to assess the lockdown situation. The teams constituted by the Union Home Ministry will assess various aspects of the ongoing lockdown. More from our Kolkata correspondent.
The 2 5-members interministerial central teams headed by an additional secretary-level officer of the government will visit 7 districts of the state. One team headed by Apurva Chandra will visit various parts of hotspot areas of South Bengal districts including Kolkata, Howrah, North 24 Parganas and East Midnapur districts, while other team headed by Binit Joshi will go to Darjeeling, Jalpaiguri and Kalimpong districts of the North Bengal. The Union Home Ministry has expressed serious concern over violation of lockdown norms in these districts which may cause the spread of coronavirus. The ministry instructed to the committees to issue necessary directions to the state government for redressal of the situation after on-the-spot assessment and submit a report to the centre. Arijit Chakraborty, AIR News, Kolkata.
In Rajasthan, a central interministerial team has reached Jaipur yesterday for monitoring of containment work of COVID-19 in the city. This team may visit Ramganj and other areas of the city today which are affected by the COVID-19 pandemic. The team is scheduled to visit SMS Hospital and meeting with the officials of the State Task Force. Jaipur is the hotspot of coronavirus, where 585 cases have been reported so far. Against the backdrop of increasing number of patients and victims of corona in and around Pune, the central interministerial team visited Pune once again yesterday and gave appropriate instructions in consultation with senior administrative as well as police officials. The central squad was informed about the steps taken by the administration to curb the spread of corona in Pune and Pimpri Chinchwad. 2 interministerial central teams are scheduled to visit Mumbai today to make an on-the-spot assessment of the situation and issue necessary directions to the state authorities for its redressal. They will submit their report to the central government in larger interest of the general public. In Madhya Pradesh, a 5-member central team reviewed the corona outbreak situation in Indore yesterday, which is the most affected city of the state. Central team inquired about the distribution of groceries, ration, medicines and other essential items during lockdown, management of health services, social distancing and arrangements made for migrant labourers. The team also had discussions with the senior officers of Indore during the meeting.
A total of 17,656 confirmed cases of COVID-19 have been reported in the country so far. Out of these, 2,841 patients have recovered and were discharged from the hospitals, while 559 patients have died. Briefing media in New Delhi, Health Ministry officials said that India's doubling rate of COVID-19 cases before lockdown period was 3.4 days and now it has slowed down to 7.5 days.
इंडिया का डबलिंग रेट लॉकडाउन से पहले जो 3.4 था अब वह इम्प्रूव होकर 7.5 हो चुका है और इससे संबंधित और भी एक अच्छी न्यूज ये है कि अगर हम 19 अप्रैल तक का डेटा लें तो इस नेशनल एवरेज के तहत 18 स्टेट्स में नेशनल एवरेज से बेटर परफॉर्मेंस और बेटर इम्प्रूवमेंट नोटिस किया गया है.
The official informed that Mahe in Puducherry, Kodagu in Karnataka and Pauri Garhwal in Uttarakhand have not reported any COVID-19 case in the last 28 days. He said the number of districts where no case has been reported in the last 14 days has increased to 59 districts of 23 states. He said the doubling rate of COVID-19 cases is more than 30 days in Odisha and Kerala and there is no active case in Goa now. Prime Minister Narendra Modi has said India and Afghanistan share a special friendship based on ties of history, geography and culture. Responding to Afghanistan President Ashraf Ghani, who thanked India for providing medical and other support, Mr. Modi said, for long the two countries have fought jointly against the scourge of terrorism and they will similarly combat COVID-19 together with solidarity and shared resolve. Earlier, the Afghanistan President thanked Prime Minister Modi for providing 500,000 tablets of hydroxychloroquine, 100,000 tablets of paracetamol and 75,000 metric tons of wheat.
Union Finance Minister Nirmala Sitharaman appreciated New Development Bank NDB's effort on fast-tracking of financial assistance of about $5 billion to BRICS countries, including an emergency assistance of $1 billion to India to combat the COVID-19 pandemic. She also suggested that assistance under this facility to be enhanced to $10 billion. Ms. Sitharaman was attending the 5th annual general meeting of the Board of Governors of New Development Bank through a video conference in New Delhi yesterday. In her opening remarks at the meeting, the Finance Minister commended the NDB's efforts in establishing itself as a credible global financial institution, delivering its mandate successfully by taking more sustainable and inclusive approach. She also mentioned about Prime Minister Narendra Modi's initiative of creating a COVID-19 emergency fund and India's efforts in supplying critical medicine to the needy countries to tackle the COVID-19. Ms. Sitharaman also outlined various measures taken in India to respond to the COVID-19, including allocation of 15,000 crore rupees for strengthening the healthcare system, an announcement of a scheme of social support measures amounting to $25 billion to alleviate the hardship of the poor and the vulnerable. The Economic Advisory Council of the 15th Finance Commission will meet this month to discuss implications of the COVID-19 pandemic on GDP growth. The Council members will meet on 23rd and 24th of this month through online medium, which will be presided over by the Chairman of the Commission, N.K. Singh. The members would also be discussing on the possible assumptions for tax buoyancy and revenue in the current and next financial year. Discussion on public expenditure, to shore up the economy, would also be on the agenda.
Government has issued an advisory to all newspaper and media establishments to ensure that adequate care and precautions are taken by media persons in the wake of COVID-19 pandemic. In a tweet, Information and Broadcasting Minister Prakash Javadekar said it is shocking that more than 50 journalists of electronic media, particularly camera persons, have been found coronavirus positive in Mumbai. He said every journalist should take proper care.
In order to check the spread of fake news on social media, Press Information Bureau has set up a dedicated unit to bust rumors getting viral on the social media. PIB Fact Check is a verified handle on Twitter that continuously monitors trending messages on social media platforms and conducts comprehensive review of its contents to bust fake news. Besides, PIB_India and various PIB regional unit handles on Twitter are posting official and authentic version of any item on Twitter using the hashtag PIB Fact Check for the benefit of the Twitter community at large. Any person can submit to PIB Fact Check any social media message, including text, audio and video to check its authenticity. These can be submitted online on the link factcheck.pib.gov.in or on WhatsApp number 91 8799711259 or email to pibfactcheck@gmail.com. PIB Fact Check yesterday busted the myth that insecticides like the sodium hypochlorite can be sprayed on people, stating the fact that it is used to disinfect articles frequently touched by people and can be harmful on humans. Another rumor was busted that Uttar Pradesh Police, UP Dial 112, has issued rules and regulations for operating WhatsApp groups. It was clarified that no such advisory has been issued.
Government has said that 301 Lifeline Udan flights have transported 507 tons of medical supplies across the country during the lockdown period. Civil Aviation Ministry said 184 of these flights have been operated by Air India and Alliance Air. Our correspondent reports that helicopter services, including Pavan Hans Limited, have been operating in Jammu and Kashmir, Ladakh Island regions and Northeast region, transporting critical medical cargo and patients.
Lifeline Udan flights have covered over 3 lakh kilometers of aerial distance to transport essential medical cargo to remote parts of the country. Special focus has been given on the Northeast region, island territories and the hilly states. Air India and Indian Air Force collaborated primarily for Jammu and Kashmir, Ladakh, Northeast and other island regions. Domestic cargo operators SpiceJet, Blue Dart and Indigo are operating cargo flights on a commercial basis. Bulk of the cargo comprises products like masks and gloves. A portal for coordinating Lifeline Udan flights was developed by the National Informatics Center to enable seamless coordination between various stakeholders. With Dipendra, Suparna Saikya, AIR News, Delhi.
Over 25,000 COVID-19 related portal grievances have been redressed in the last 20 days, beginning from the 1st of April. Union Minister Dr. Jitendra Singh disclosed yesterday about the current status of the National Monitoring Dashboard launched by the Department of Administrative Reforms and Public Grievances under the Ministry of Personnel following the declaration of nationwide lockdown. He said the grievance portal has received tremendous response from people from across the country in the last 3 weeks. This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Centre interministerial teams reach West Bengal, Madhya Pradesh, Rajasthan and Maharashtra to make on-the-spot assessment of COVID-19 outbreak. Finance Minister Nirmala Sitharaman appreciates New Development Bank's emergency assistance of $1 billion to India to combat COVID-19 pandemic. 15th Finance Commission to assess implications of the COVID-19 pandemic on GDP growth. 301 Lifeline Udan flights transport 507 tons of medical supplies across the country during the lockdown period. Anganwadi workers and assistants of Madhya Pradesh to get benefit of Chief Minister COVID-19 Yodha Kalyan Yojana. And in a highly volatile situation, US crude oil futures hover around $0 per barrel for the first time. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
In our series, Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, President of Public Health Foundation of India, Dr. K. Srinath Reddy said, India is in a much better position as compared to the rest of the world as far as COVID-19 cases are concerned, and the measures taken are showing results.
We started getting affected later than many other countries, but we are presently in a much better position than the rest of the world, and in that sense, we are better protected. However, we still have to watch how the epidemic advances before we can come to a judgment. But right now, it appears that our measures taken progressively from February and peaking with the lockdown are now paying dividends and showing results.
Talking to AIR News, Dr. B.N. Gangadhar of the National Institute of Mental Health and Neurosciences, Bengaluru, advised people to do exercise and practice yoga to make themselves free from anxiety and stress.
You can do the exercises together with your family members. You can do the yogasanas or meditation together with the family members if you have learned, or if somebody can teach you, a neighbor can demonstrate. Other videos are available today. You can actually do bhajans together. You can watch some healthy TV programs together.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. Nand Kumar, Head of Psychiatry Department at AIIMS, will participate in the discussion. Listeners can ask questions to the experts on toll-free number 1800-115767. You may also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. Indian cricketers have urged people to wear masks and take all the necessary precautions against COVID-19. Sachin Tendulkar, Virat Kohli, Saurav Ganguly, Rohit Sharma, Harbhajan Singh and others appealed to people to wear homemade masks and become a part of Team Mask Force in the fight against COVID-19.
आप अपनी पूरी फैमिली के साथ हमें चेयर करते हैं और आज मैं आपकी पूरी फैमिली से ही बात करने आया हूँ। टीम इंडिया का हिस्सा होना एक बहुत गर्व की बात है। आज एक उससे भी बड़ी टीम बनने जा रही है, टीम मास्क फोर्स।
जैसे हमारे प्रधानमंत्री ने कोरोना वायरस से लड़ने के लिए तरह तरह के टास्क फोर्स बनाए हैं, उसी तरह हम 130 करोड़ हिंदुस्तानियों को भी अपने घरों में कोरोना वायरस के खिलाफ बनानी है एक मास्क फोर्स।
मास्क फोर्स का हिस्सा बनना बहुत ही आसान है। बस घर बैठे बैठे अपने लिए एक मास्क बनाइए।
ये किसी भी साफ कॉटन के कपड़े से बनाया जा सकता है।
कम ऑन इंडिया, मास्क बनाओ और मास्क फोर्स का हिस्सा बन जाओ। और हाँ, याद रहे, साथ ही 20 सेकंड तक हाथ भी धोने हैं और सामाजिक दूरी भी बनाए रखनी है।
मास्क घर बैठे आसानी से कैसे बनाना है, इसकी सारी जानकारी आपको आरोग्य सेतु ऐप पर मिल जाएगी। आज ही डाउनलोड कर लीजिए।
In Madhya Pradesh, around 1 lakh Anganwadi workers and assistants of the state will get the benefit of Chief Minister COVID-19 Yodha Kalyan Yojana. Under this initiative, they will also get a special health insurance cover of 50 lakh rupees. Our correspondent reports that special insurance scheme has been launched by the central government for health workers who are fighting against COVID-19 epidemic.
Principal Secretary of Women and Child Development Department Anupam Rajan has informed that Anganwadi workers are taking risk by conducting door-to-door survey in every district. Besides, they are also visiting from house to house for providing nutritional food to the children. In such a situation, they have contact with many people, which pose a risk of corona infection. Therefore, they should be given the benefit of this insurance scheme. The state government has already asked the collector of all the districts to declare the Anganwadi workers and assistants eligible under the Chief Minister COVID-19 Yodha Kalyan Yojana because of their exposure and active role in fight against coronavirus. Meanwhile, the state government has given 1-year exemption to the private schools for renewal of accreditation due to COVID-19. For all such schools, the prescribed fee for renewal has also been postponed till the next session. Sanjeev Sharma, AIR News, Bhopal.
In order to provide health services in the wake of COVID-19 pandemic, the Himachal Pradesh Health Department has come up with a unique idea of providing free online medical consultation to sick people at their residence through e-Sanjeevani OPD. Here's more from our correspondent.
Health Department has come up with an idea of e-Sanjeevani OPD through which general health advice will be provided to the people at their residence throughout the state. Under e-Sanjeevani OPD, 16 doctors of various medical colleges of state will provide free healthcare advice on all working days from 9:30 a.m. to 4 p.m. To take advantage of this facility, one should have a computer, laptop, tablet with webcam, mic, speaker and internet connection. To avail free medical consultation, one has to log in esanjeevaniopd.in. Soon this facility will also be made available on mobile phones in state. Sanjeev Sundrial, AIR News, Shimla.
In Bihar, the number of positive cases of COVID-19 has gone up to 113 after the reporting of 17 new cases. These cases were reported from Bihar Sharif area in the Nalanda district. Number of positive cases of this district mounted to 28. In view of the increasing number of positive cases, the state government has sealed Bihar Sharif area, while Nalanda has been put on alert. 45 persons have been completely cured from coronavirus and 2 persons have died of the same pandemic. In Karnataka, Bangalore Mahanagara Palike has launched the Containment Incident Command System in 19 containment zones. More from our correspondent.
Under the system, incident commanders are appointed for each containment zones with magisterial powers. They are assisted by police and health workers. Special care is being taken in these zones for medical checkup, monitoring, garbage disposal, supply of essential commodities to people living in these zones who are not allowed to come out of their houses. The pandemic among the employees of Jubilant Life Sciences Pharmaceutical Company in Nanjangoodu has spiked to 69, resulting which 2,098 people have been quarantined. Out of 1960 samples tested for viral infection, 1891 have been found negative and 138 samples results are awaited. Sudhindra, AIR News, Bengaluru.
The Indian Railway Catering and Tourism Corporation, IRCTC, has been providing healthy food packets to people stranded in various places because of the national lockdown in many towns and cities. In Madurai, Tamil Nadu, where religious tourist footfall is usually very high, the IRCTC outlet has been preparing and distributing food packets from the 8th of April onwards.
Tamil Nadu has joined the states who have extended the lockdown further, with the government announcing that the curfew would continue till May the 3rd. 43 new COVID-19 cases have been confirmed yesterday, taking the total to 1,520, while 46 others were discharged. 2 people, including a senior neurosurgeon from Chennai, died of the disease since Sunday evening. More from our correspondent.
Many political leaders in Tamil Nadu, including the state health minister, have expressed anguish that the mortal remains of a doctor who died of COVID-19 in Chennai on Sunday could not be laid to rest in a city cemetery due to alleged mob violence by locals. This is the second such incident in the city that the body of a doctor had to be shifted to a different place due to local opposition. Doctors have insisted that the fears of the disease spreading from the dead are clearly unfounded, lacking any evidence. Adding that the standard operating procedures of the ICMR are being followed. Meanwhile, the Madras High Court has suo motu filed a case against those responsible for the mob violence. The city police have so far booked 20 people involved in the attacks. Jai Singh, AIR News, Chennai.
In Gujarat, because of the rising number of cases from the hotspots of Ahmedabad, Surat and Rajkot, the government has decided to extend curfew in parts of all the 3 cities till the 24th of April. Our correspondent reports that the Chief Minister, Mr. Vijay Rupani, yesterday appointed 8 top-level officials to monitor COVID-19 situation in these cities. A total of 1,939 positive cases have been reported in the state so far.
The government is continuing proactive testing in the hotspots of the state. In Ahmedabad, the city administration has started screening and testing of vegetable vendors, shopkeepers and garbage collectors who come in contact with many people. The city reported 1,173 cases so far, out of which 912 cases have been reported from the areas of walled city. The number of people recovering from COVID-19 is also increasing in the state. 25 persons were discharged from the hospital yesterday after recovery. Meanwhile, 400 industrial units in 8 districts, including chemical, ceramic and textile industries, resumed their operations from yesterday. They have been asked to follow certain conditions such as thermal screening of employees, social distancing at workplace, among others, or else their permission will be cancelled. Economic activities in the rural areas are also gearing up with the resumption of APMCs in the state. Aparna Khoot, AIR News, Ahmedabad.
In Uttar Pradesh, IIT BHU have developed a special UVC sterilizer which will disinfect and sanitize any vehicle. The device, developed by Malviya Center for Innovation, Incubation and Entrepreneurship, will prove helpful to the vehicles of police and ambulances of medical services which are being used for the transportation of corona patients. A report.
The device is a battery-operated sterilizer which works on radiation theory and produces ultraviolet rays which kill the microorganisms like virus, bacteria and function on the whole body of the vehicle. Professor P.K. Mishra, head of the Malviya Center for Innovation, Incubation and Entrepreneurship of IIT BHU, told AIR,
1200 माइक्रोवाट सेकेंड पर सेंटीमीटर स्क्वायर का अगर इरेडिएशन डोज मिलता है तो कोरोना वायरस 90% मरता है, लेकिन अगर हम डोज को बढ़ा दें वापिस शो करें तो 99%, तो हम लोग सेफ्टी में हमने पूछे 3000 माइक्रोवाट सेकेंड पर सेंटीमीटर स्क्वायर से ज्यादा की डोज रखी है.
The device developed by Gaurav Singh, an incubatee at Malvi Center for Innovation, Incubation and Entrepreneurship of IIT BHU, costs between 2500 to 3000 rupees. Use of this device will help in keeping the vehicle corona-free and reduce the fear of getting infected by use of police vehicles and ambulances. Sushil Chandra Tiwari, AIR News, Lucknow.
In the Union Territory of Jammu and Kashmir, Bashir Ahmed Khan, advisor to Lieutenant Governor, has said that the agriculture and horticulture activities shall be resumed soon, as these had stopped because of the outbreak of novel coronavirus. He said this during a meeting of senior officers in Srinagar yesterday. Here's more from our Srinagar correspondent.
Soon after the announcement of resuming the MG Narega works in Jammu and Kashmir, Advisor Bashir Ahmed Khan said that government is taking various measures to resume the agriculture and horticulture activities in J&K with safety precautions. He directed zonal agriculture officers to provide the list of movement passes required for resuming the farming activities. Mr. Khan also interacted with religious leaders and asked them to advise their followers against holding any congregation and spread awareness about observing social distancing norms to prevent the transmission of COVID-19. He also interacted with the representatives of business community and lauded their efforts in their battle against the pandemic. Sunil Kohl, AIR News, Srinagar.
Chhattisgarh Chief Minister Bhupesh Baghel has sanctioned 25 lakh rupees each to all the 28 districts of the state for prevention of COVID-19 infection. A total of 7 crore rupees has been sanctioned from the Chief Minister's Relief Fund. These funds will be spent on necessary resources, essential goods and relief works for prevention of corona infection.
Raju Bhai, a construction labourer from Gandhinagar, says the support in terms of free ration is helping his family to survive in these hard times of the lockdown.
मेरा नाम राजू है, मजदूरी काम करता हूँ. सरकार ने 3 महीने के लिए हमको अनाज दिया है. इससे हमारे को बहुत राहत मिली है. इससे हमारा परिवार का भरण पोषण होता है. इसके लिए मैं सरकार का आभार व्यक्त करता हूँ.
Vikram Rathwa, a farmer from the tribal dominant Chota Udaipur district of Gujarat, received benefit from multiple welfare schemes during the lockdown.
छोटा उदयपुर से विक्रम राठवा बोल रहा हूँ और तीन बच्चों का 1200 रुपया लेके 3600 रुपया पेंशन भी जमा हुआ है और किसान का 2000 रुपया मेरे खाते में जमा है और अनाज रेशन कार्ड का भी मेरे मुफ्त मिल चुका है.
U.S. oil prices rebounded back above zero today, a day after crude oil futures ended in negative territory for the first time as the ongoing COVID-19 crisis triggered a collapse in demand. U.S. benchmark West Texas Intermediate WTI for May delivery was changing hands at USD 0.56 a barrel after closing at minus USD 37.63 in New York, the lowest level since oil futures trading started in 1983. President Donald Trump tweeted yesterday night that he would be signing an executive order to temporarily suspend immigration to the United States. The president said he would be signing the order in light of the attack from the invisible enemy, as well as the need to protect the jobs of our great American citizens. And now, an overview of today's newspapers covering the COVID-19 stories. India has 11 million COVID-19 warriors, says a government database, is headlines in the Hindustan Times. This time, due to COVID-19 lockdown, it will be an E-Akshaya Tritiya on 26th April, says a Business Standard report, saying that people are still likely to buy jewellery and discounts are likely to be there. A former judge of Punjab High Court, Justice Preetam Pal, has written to the President to perform a Mahayagya to fight coronavirus, much like Raja Janak had done for the famine. That's Tribune's report. He had actually seen dead trees turn green due to Yagya powers, says the judge. Delhi's Azadpur Mandi to be open 24/7, curbs to continue, says a Pioneer headline. Speed of virus infection slows, doubling time rises in 18 states, says the Hindu. And finally, the Hindu also has a story of Dr. Mona Milkha Singh, the daughter of legendary Milkha Singh, who is working tirelessly and relentlessly in a New York hospital for the COVID-19 patients.
And now, before we end the special news program on COVID-19, the headlines once again. Centre interministerial teams reach West Bengal, Madhya Pradesh, Rajasthan and Maharashtra to make on-the-spot assessment of COVID-19 outbreak. Finance Minister Nirmala Sitharaman appreciates New Development Bank's emergency assistance of $1 billion to India to combat COVID-19 pandemic. 15th Finance Commission to assess implications of the COVID-19 pandemic on GDP growth. 301 Lifeline Udan flights transport 507 tons of medical supplies across the country during the lockdown period. Anganwadi workers and assistants of Madhya Pradesh to get benefit of Chief Minister COVID-19 Yodha Kalyan Yojana. And with that, we end the special news program on COVID-19.